Flesh-eating disease was contracted here in Idaho by a woman. The scientific term for this disease is necrotizing fasciitis. Local News 8's Taja Davis talked to an ERMAC physician. So Taja, how contagious is this disease?
Jay, because necrotizing fasciitis is a bacterial infection, it is somewhat contagious. But as long as you take care of your wounds and keep them covered, it won't spread from person to person.
The necrotizing fasciitis is an infectious disease that is characterized by bacteria. They get underneath the skin and rapidly destroy the skin and the soft tissues.
Many people have certain risk factors that may have them contract the disease easier than others.
In each of the cases that I've been involved with this year, they have all had risk factors for it, such as diabetes. They had very poor wounds. They weren't taking care of themselves from a hygienic standpoint as good as they should have, and they didn't seek prompt medical recognition.
And there are 4 types: a strep bacteria, polymicrobial bacteria, bacteria found in infected fresh water, and a bacteria related to fungus. In many cases, the disease can prove fatal for people, or for others, loss of limbs.
It's here, we recognize it. You know, I see it just as much here as I did back in Georgia, just as much back in Florida. It's around, it's always the same bacteria. It just depends on the situation where the patients are, if we're going to see it or not.
There isn't an abnormal amount of people with the illness in eastern Idaho. The disease is very rare, but with antibiotics and sometimes surgery, patients can resume their lives. Live at ERMAC, I'm Taja Davis.
Thank you, Taja. Early recognition is the key to maximizing survival and minimizing the damage the flesh-eating disease can do. Coming up in the